So good morning, everyone, or good afternoon or good evening, depending on where you're calling in from. Thanks for joining us for today's 1-hour webinar hosted by Prevention Plus Wellness LLC, located here in beautiful St. Augustine, Florida. It is a gorgeous, warm day here today. I hope it's nice where you're at and you're all healthy and happy and safe. So thanks for joining us. I know there's a lot of you now are transitioning to summer break, so I really thank you for spending time with us. And I hope you do have a really good, restful summer break. So we have an hour together today, and as usual, you can see the topic is implementing PPW, that's Prevention Plus Wellness, youth and parent programs, and our new media campaign. So I'm going to give you step-by-step directions for implementing all of these programs. Today, that's the focus today. I am recording this session, so all of you that have registered for today's session will be receiving these PowerPoint slides and a link to this recorded session, which I hope you will share widely with your friends and colleagues in your region and state, even in your nation. So, and then also 1 hour CEU credit for those of you that are interested in that, for those of you that are with us live at this time. So I guess that's it. Does anybody have any questions before we begin? If you have any questions, do find in your toolbar the chat space for the Q&A, and you could click on that at any time throughout the session and type in your comments or questions. And then we will be looking at those, especially at the end of the slideshow, for an open-ended discussion. So please do participate today. Don't sit back, but use this as an opportunity to give your opinions, your point of view, share with your colleagues here that are on this webinar at this time. If you have not been, and I think you probably all have been, because of this webinar, but if you haven't been for some reason or haven't been recently, please do go to our website, preventionpluswellness.com, and make sure you've dropped in your email and your name so that you are notified about future free webinars and other research and activities coming out of PPW. So let's go ahead and take a look at what we've got. We've got 3 objectives today. We're going to be reviewing with you the steps for implementing Prevention Plus Wellness youth, as well as parent programs and immediate campaigns. Secondly, we will be discussing examples for implementation settings and populations for PPW programs. And thirdly, we're going to describe options for lesson follow-up, a little bit about evaluation, not too much, because we'll have a separate webinar just focused on evaluation. Okay, any questions? Again, feel free to type in your response, your questions at any time in the chat or Q&A space. All right, let's start with steps for implementing PPW youth programs. And there's a picture of our cover page of our sport, which is our alcohol and drug prevention plus wellness program for youth, which comes in high school, middle school, elementary school versions. We actually discussed that last week. All of our programs provided an overview of all of our programs last week. If you missed that, check out our YouTube channel, Prevention Plus Wellness. All right, step number 1. So I'm going to go through these steps for implementing youth PPW programs. It doesn't matter if the program is sport, PPW, or marijuana, or vaping, which is our e-cigarette, or opioid PPW. It doesn't matter if it's racial justice, in God's image, even sport 2. Am I missing anything? All those programs, they're manual programs. You have a manual with scripts in it. You have a digital download. We'll cover all that in the steps for implementation. But if you have any of those, these are the steps for providing this program to your youth individually or in a group. Step number 1, get trained. Now, we are going to be talking, obviously, about the steps for implementation, but that's really not sufficient to make the most of these programs and get the most out of them. I mean, you're spending your hard-earned grant dollars and donation dollars for these programs. So you do want to make the best use of them, use them as well as you can so that they're implemented with quality, with fidelity, and maximize effectiveness. And to do that, you really need to have training. The good news is our training programs now are online, self-paced, and you can get through them very quickly. The good news is that because all of our programs are scripted in these manuals, it really does cut down on the training. You can get through the self-paced training probably between an hour or two, depending on how quickly. But if you could start it, you can come back to it. You've got 14 days to get through the self-paced training. Very simple, very intuitive, very well laid out, very interactive. I think we've get very good feedback on our new self-paced online training. So get trained, and that training will allow you to be a certified program implementer of our programs. And that's good for 3 years. So do get trained. I can't tell you how important that is, but we don't add training to our programs. We have them separated. We have program costs and we have training costs for those that can't afford the training perhaps, or don't feel that they need the training, even though I can't express enough how important training is. And from our experience, how training makes a significant difference in the outcomes that you'll see from your program. So get trained, step number one. Step number two, practice your scripts before implementation. So that's the main homework that you have, whether you're a professional prevention specialist, whether you're a health specialist, whether you're a teacher, whether you're a coach, whether you're a youth leader, it doesn't matter. What you want to do is in your manual, you'll have 2 scripts. One script is to follow to provide your program to youth individually, one-on-one. The other script is to provide it to 2 or more youth in a group setting. And you could practice either script or both if you're going to use both of those, but practice, 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 practice makes perfect. And we always say practice at least 3 times aloud, showing your PowerPoint slides so that you feel comfortable with implementation of your program. And then you can just glance down at your manual, focus on your youth, because you'll have your script almost memorized. Most of our programs are very, very brief. And so by practicing, it'll make you more comfortable, and it'll almost have the script memorized, and it'll flow much better, and you'll feel more comfortable and enjoy implementing it. And your youth will enjoy it, or your young adults as well will enjoy it. Almost for In Shape. That was one of our programs I forgot to mention before, our In Shape PPW program for young adults. So step number 2, practice your scripts before implementing with youth. Step number 3, if you do make any changes to the slides, your program slides, do send them to us for review so we can see what you're doing, we can learn from you, we can give you feedback, we can share what you're doing with others. And if you're going to co-brand your slides, as in putting your logo on, colors, whatever, you don't need to share that with us. That's fine, go do that. If you're going to change the content, and particularly if you're going to add any content, meaning let's say an additional slide or some content in a slide, do make sure we take a look at that first. So for example, some organizations have added, more information about goal setting for youth. They've added information on high caffeinated drinks, whatever you want to do. If you're going to add more content, somebody the other day, we were talking with somebody who wants to have violence addressed. I think violence can be easily addressed within our programs. At this point, we don't have a violence prevention program. So if you want to add a little extra content or a slide or 2 about violence, feel free to do that if it fits, and send it to us. Send it to us for review and for feedback. We want to ensure that the model stays intact. So the behavior image model, positive images, positive illustrations, linking substance use prevention and avoidance with the promotion of protective wellness behaviors. brief screening, feedback, goal setting, evidence-based practices will ensure that that's intact by being able to review any slides if you tailor them. The other thing some organizations will do will actually switch out some of the illustrations or the pictures. The pictures are highly positive, different ethnicities, genders, activities, but if they don't fit your population, if your population is more, may say they're all African American, let's say they're all outdoors, setting, then you may want to switch some of the images. That's fine. Do that so that your youth and young adults can see models and representations of themselves in those pictures. But again, that means you've tailored your slides. Send them to us for review before you use them. Okay, any questions about those 3 steps? Training, practice your script, send us any slides that you wish to tailor. Tailoring is very easy. We highly recommend it if it's necessary to meet the needs of your population or your setting. So we think, we agree that tailoring can make an important difference because every such situation is different, populations are different, implementers are different. So unlike other evidence-based programs, we believe of this kind of customization can be important in certain situations. If you don't think so, feel free to contact us and we can talk about it. info at preventionpluswellness.com or call us at 904-472-5022. Another type of tailoring is translation. We're in the middle of translating our sport programs into Spanish. So that's coming up. And so that's another form of tailoring, and we'll be doing that from our end. Step number 4 of steps for implementing your Prevention Plus Wellness program to youth or young adults is make copies of your program materials for your participants. So you'll make copies not from the manual, because the manual has don't copy on it, but you will make copies from your digital download that comes with your manual. That link you'll save to your computer for safekeeping. I just had someone today say, hey, I've lost my link to my PowerPoint slides and materials. Save it to your computer so you don't lose it. It includes your PowerPoint slides, but it includes all your reproducible materials like your screening surveys, your goal plans, maybe pre-post tests if you're using sport, parent flyers, etc. So make copies. If you have 20 youth you're presenting to next week, make 20, maybe 25 extra copies of everything so you can take that to your youth individually in the classroom and implement your program. This digital download allows you to implement your program to countless youth. So it's a one purchase situation. It's really good. You don't have to keep coming back to us for materials for you or your youth. You make copies as you need them. That will save you time. And the more you implement your program, the less expensive it becomes per youth. Step number 5, administer one of the 2 pretests to participants. Now, we really believe in making data-based decisions. So, and we created these built-in pre and post tests, both the paper copy as well as the online version. We created these for you so that you can get very focused feedback from your youth as to how well your PPW program is working for them. So it's very focused, it's very practical, it's set up to be very practical, be implemented immediately before your lesson and immediately after your lesson, pre-test and post-test. And because prevention works differently than intervention or treatment, meaning when we prevent something, we don't see it, this will allow you to actually see outcomes for the first time. So it'll give you that critical feedback and data that you need to promote your program to other youth and parents and organizations and funding agencies, et cetera, and to improve your program over time. So data, very, very important. So you've got a pretest and a post-test. You've got the paper copy, and you can make copies of that from your digital download, bring it to your students, one or groups, give them the pretest, have them complete it. You probably need to bring some pencils or pens. Launch and complete your lesson, hand them the post-test. At the end of the lesson, you pick up your pre and your post-test, put them together so they're physically next to each other, put them in a box or an envelope, and when you're ready, you can hand enter those data into an online template, which we can send you. That's one version, the paper version. We can also send you a customized link and QR code to an online version. So if your youth have tablets or phones, smartphones, you can give them the link, you can give them the QR code. They do the pretest. You present your lesson, send them the link to the post-test. They can do the post-test. You don't even have to touch the data. That's the better approach because it's more efficient, saves you time, probably even improves the quality of reporting from students because they're more likely to feel comfortable answering online than they do in a paper format when you're there. Make sense? If you have any questions, let me know. That's step 5. Now, do you have to implement the pretest and post-test? No. Should you? Yes, because again, I'm trying to explain the critical importance of this data. We've learned that when you do, for those organizations that do collect these data and we interact with them, they end up having better experiences and better outcomes. Now, what if your what if your funding source has other requirements for data collection? Well, that's a decision you'll have to make. Is it going to be too much for you to collect data from based on the funding source and the pre and post test? It's up to you. But if you have questions, if you want to discuss this with us, you could reach us anytime at info@preventionpluswellness.com. We're always available to give you a hand and help you with your program. Step 6, implement the program using the selected script with slides. You've already practiced it. You're very comfortable whether you're implementing this to one youth or groups of youth. You show your slides. You have your manual with your script. You focus on good presentation skills, looking at your youth, lots of enthusiasm and passion. Remember, PPW programs are motivational programs. So you're motivating youth to want to change their lives and then give them goal setting to initiate that behavior change. So that's what this is all about, motivation and the behavior change for youth, not just to avoid substance use, but to improve critical health behaviors. Step number 7, read the goal plan with participants and help them complete it. That's the action piece. You'll read the goal plan with them, walk them through the goal plan. It has several different sections to it, which we discussed at last week's webinar. And this is the action piece. This is where if you set goals and monitor goals, and these are short-term goals, a 7-day, 1-week goal plan. And if they set goals the second week and the third week, they will develop self-efficacy, self-confidence, and self-regulation or self-control skills and learn to start shaping their own behaviors, which are so critical to physical and mental development of youth and much needed among youth, especially high-risk youth. So goal setting and developing the goal and monitoring of goals, practices, behavior, very, very critical to behavior change and essential to successful behavior change. That's why we've got this built in as a key component of all prevention plus wellness brief intervention: screening, feedback, and goal setting. That's step 7. Step 8 is to administer one of the 2 post-test surveys. So, I mean, you'll be implementing the same type of post-test as your pretest. In other words, if it was paper pretest, you'll do a paper post-test. If it's online pretest, do an online post-test. We actually have 2 versions of the pre and the post-test. The one that most organizations will use is the immediate pre-post. You present that to youth, administer it to youth immediately before the lesson and after the lesson. You don't have to follow up with youth. it's really, there's no reason for you not to use it, except perhaps that you don't have time within your window for program implementation, for your lesson implementation. Other than that, you really need to do that because of the wealth of information you'll collect, both qualitative data as well as quantitative data, to assess changes in risk and protective factors for substance use, as well as all the targeted health behaviors, physical activity, breakfast, nutrition, sleep, stress control. All of those things are risk and protective factors are measured in your immediate pre-post. The other pre-post survey we have is actually a health behavior survey. You could implement that immediately before the lesson, but because it measures 30-day substance use and health behaviors, the post-test has to be implemented at least a month after your lesson. So that's the health behavior survey. It's an optional online survey. Because you have to come back to youth a month later, there is a little bit more effort and work. But the beauty is you're measuring not just risk and protective factors, but actual behaviors, 5 measures of substance use behaviors and multiple healthy habits as well. That's step 8. Step 9, remind your participants to post and monitor their goals daily, and at the end of the week to rewrite a second set of goals. So you could actually give them a copy, another blank copy of the goal plan to have them continue their goal setting. You could send them a link to a free online goal plan that we provide. Or if you have a chance to meet with youth again the following week, you could focus on goal setting. What worked, what didn't work. Let's help each other set goals for the next 7 days. The more practice you give youth week after week to set goals and monitor them on a daily basis, the more likely they'll develop self-regulation skills. That's step 9. Step 10 is to use the parent flyers. Now, this is the sport program. Is unique because it has flyers, a letter to parents, and 4 weekly flyers. These flyers can be mailed out, handed out, emailed, posted on website, anything you want. And this reinforces, to the extent that this information and these flyers get home to parents and they talk to their kids about this, the parents will provide the same positive behavior and image communications that you're providing to your youth, these youth in schools or community settings. So kids will hear reinforcing messages. They'll hear PPW messages, messages that link prevention with wellness, not just from you, but reinforced from their parents. And that's what these flyers are about. Of course, we also have parent programs, and we'll be discussing how to implement those in just a minute. So you've got these parent flyers. If you're using the sport program, it's a separate intervention. So you can follow up with your initial presentation to your youth by handing out or sending out these weekly flyers to parents. Also, we highly recommend that you re-implement your Prevention Plus Wellness program, whichever one you have, at least on an annual basis, or even some organizations, even every semester. So that's not a problem. It's a good tool to get youth to think about their health behaviors, for you to provide positive motivational communication, and for youth to set goals to avoid substance use and improve their healthy habits. So that's follow-up. We'll be talking more about follow-up in a bit too. Step 11, complete the Instructor Survey. This is a tool. The Instructor Survey is a tool for you to assess the quality with which you've implemented your lesson. And the quality of lesson implementation can vary over time and groups and situations and so on. So you want to complete your Instructor Survey at the end of every lesson presentation to see for yourself, how well did you do? Did you miss anything? And you assess your quality. For example, how well did you present your lesson in terms of enthusiasm and passion? If it wasn't very enthusiastic or passionate, then that's something you can work on and try to increase and improve the next time you present your lesson. So this is the Instructor Survey. Very, very important tool for you to use and complete at the end of every PPW lesson presentation. We also have for step 12, a program Fidelity checklist, and that's a good tool to complete every month or so to make sure you're implementing your program as it was designed to be implemented. Step 13 is if you've collected from each youth or young adult a paper pre and post test and put them together and put them in a box or an envelope, and you're done at the end of your period, whatever that would be, a week, a month, a semester, a year, and you want to look at these data, contact me at info@preventionpluswellness.com. Ask for our pre-post survey template. We'll send you a customized link, and then you could enter each person's pre and post test together, one at a time. And when you're done entering the data, we'll send you the link to access the SurveyMonkey charts, and you'll have a ton of information. And it's very easy to do, but it will take you some time. So that's the downfall and the problem with the paper surveys. You do have to take time to enter the data. We can enter it for you, but if we're going to use our time, we will, there's a charge for that. So most often organizations will enter their own hard copy survey data, and we'll send you the template link for free. Step 14, request data charts from us. So if you entered your data in the template, or if you had your students complete their data online, pre and post survey, all you have to do is shoot us an email or call me. I'll send you the link to the data. I will also typically look at the data myself, review it, give you an initial sense of what we see, and we can go from there. All of that is for free. If you want more in-depth analyses, if it's going to take time from us, there will be a charge for that, but you'll get at least some initial analysis from us generally for free, and because we want to see how well did it go, what worked, what didn't work. For those positive outcomes, we'll usually share those on social media. So, and you could share those with your, as a part of your reporting. So it's all good. It's all really important. And that's free and available from us, but you got to collect the data. You got to collect the data either in paper format and enter the paper data, or use the customized online links or QR codes. Step 15, don't forget to sign up. If you haven't done it today, do it now. PreventionPlusWellness.com, drop in your email and drop in your name, and then you'll be notified of free resources, webinars, etc. So that's it. Those are the 15 steps for implementing. Remember, step number 1, most important. If you are going to be using any of our programs, do take the online self-paced training. Do order that. That's really, really, really important for you, not just become a certified implementer, but to really, it walks you through the manual and really puts you in a situation where it helps you process and get comfortable with and familiar with everything that you can do with your Prevention Plus Wellness program. How about steps for implementing our sport Prevention Plus Wellness video program? So at this point in time, what we've done is we took the sport high school program, the manual program, and we translated it into a video format, so that what you have is you have a video presentation rather than you present from your manual showing PowerPoint slides. You can show this video. And the video has narration and very, very dynamic, positive imagery of youth engaged in the wellness behaviors, physical activity and sports and sleep and nutrition. Really, really good stuff, I think. And it makes it easier. So if you have coaches or teachers or juvenile justice, or maybe youth leaders, kids, that you want to have implement the PPW program, and you want to make it easier for them so that they don't have to learn the scripts and use the manual, this is a great tool. It's the video program. At this point, we only have one video. It's of the sport. I think that the images are fine and can be used with both high school, middle school, but it's only sport at this point. We don't have the marijuana or the vaping or the opioid PPW programs translated into video yet. But if we hear from you, and if you tell us, hey, we want the opioid adolescent program in video, we will likely hear that, listen to that, and if you're serious about it, we will be serious about working toward that video. So let us know what you need. We're always listening to our providers. So these are the steps for implementing the sport adolescent video program. So very simple. Number one, start showing the video in your classroom. Number two, when the video says stop to do something, you simply stop it. So if it says stop and administer your pretest, if you're going to use the pretest, stop the video, collect pretest. If you're not, continue along. Don't stop. Number three, stop the video for administering the screening survey. Your video will come with screening surveys and goal plans. You stop the video, hand out the screening survey, let everybody complete it, and then restart the video. Stop the video to administer the goal plan. Hand out the goal plan, walk everybody through the goal plan, help them complete a goal plan, restart the video, stop the video if you're going to do a post test, and that's it. It's just a matter of showing your video, letting the video do the work, and you stopping the video for the screening survey and the goal plan, and maybe even before and after the video, a pre and a post test if you're going to collect that. Okay, very simple. You don't need a manual with the video sport program. Now, these are steps for following up with youth using our brand new PPW goal plan tracking program. So we're actually testing out this online program as we speak by having a number of prevention providers throughout the country use it, test it out, and give us feedback as we correct it. But we're going to launch this full launch in the fall for people, because we got really good feedback that this is a tool that many prevention and health providers want. This is a tool that will allow you to track beyond your lesson, behind your single prevention plus wellness lesson. Keep an eye on your students electronically, virtually. Are they setting weekly goals? Are they checking their goal progress on a daily basis? This new program and tool will allow you to do that. You'll be able to follow up with your participating youth or young adults, track them on a weekly goal setting and daily goal monitoring basis over time. You as a teacher simply add the names and the emails of your youth. Participants will be notified, they log in, and they start setting their first online goal, and they start tracking the next day. They're monitoring their goal achievement. Those are the first three steps. You can then keep an eye on youth. You could send them all a message, a general message, email. You can send youth that are forgetting to set goals or have yet to start monitoring their daily goals. You could see that and you could email them. You can call them if you want to, but you can keep an eye on them and remind them to stay on track with their daily goal monitoring and weekly goal setting. So there's even an option here where you and the youth can download an app to your phone if you want to use your phones in this, using this tool, this product called PPW Goal Plan Tracking Program. There it is, PPW Goal Plan Tracking Program. So there it is, a new tool for you, for those of you that ask yourself, well, what happens to my youth after I present my lesson? I don't have contact with them. This is a way to maintain that contact and increase the likelihood that they'll develop self-regulation skills and self-efficacy. In terms of populations, we've got you covered from children all the way up to young adults, all of these youth developmental periods, children ages 8th for sure, all the way through young adolescents in middle school, older adolescents in high school, young adults in college and out of college. Programs, we have programs that address all of those developmental periods. Our programs are designed for universal prevention intervention, all youth, but many organizations provide them for high-risk youth, youth that have been caught using a substance on campus, for example, or behavioral problems, or whatever the case might be. So you can definitely use our programs for high-risk youth as well. Okay, so population-wise, we've got you covered if you work with young people that are at risk, not just for substance use, but are even at greater risk for chronic disease risk behaviors like being physically inactive, not eating breakfast, not eating fruits and vegetables, not getting sleep, lots of uncontrolled stress. PPW programs are all about that. How about settings? Where can you implement prevention plus wellness programs? Just about any setting where there's young people or young adults, from schools and colleges to military, to juvenile justice, to, well, it's coming on summer now, so camps and outdoor adventures at sports, anything, anywhere, because they're scripted, because they're brief, one single session, because you have the flexibility to provide it to you one-on-one or in a group. I mean, really, it's very, very flexible, and you should be able to have a full public health reach and reach all or nearly all of your target population, which you would not be able to do with multi-session prevention and health programs. So any setting, including homes, et cetera, you could implement your PPW program. So it's just about, I'm trying to think of a new setting that we heard recently. Seems to me there was something that I thought was rather unique. It'll come to me, but think about it. If you have a question, could I implement it here? Let me know if you have that question. Now let's take a look at implementing the steps for implementing our parent prevention plus wellness programs. Okay, so the idea behind the parent prevention plus wellness program is to give parents the tools, the practice, the materials, so that they can present the same positive image and positive behavior messages to their youth, and goal setting to their youth at home that you're presenting to them in schools and communities and boys and girls clubs, et cetera, in your community. So these are the steps for implementing the parent PPW program. Just like I think the youth programs, first of all, get trained. In fact, we just completed, just today I finished actually, a nice, new, really well-developed parent PPW online self-paced training. So this will help you implement your program with fidelity, with quality, and to maximize efficacy. So get trained, number one. Number two, provide your PPW parent program presentation to parents using the PowerPoint slides. So unlike the youth programs, the parent programs don't have a manual. You just show the slides and you present the slides and you read the slide notes, which will help you present. And you read the directions, which will help you present, and you get training, which will help you present your program. But you use these slides. The slides are the training program, the workshop for your parents. You read the notes in the slides and they'll guide you with your presentation. And that's the basis for your PPW parent program or your parent PPW program. Step three, allow parents and guardians time to practice each of the behavior message sets. So like you present messages to youth, feedback to youth, where you highlight the benefits of, let's say, physical activity and how alcohol and drugs interferes with physical activity and achieving those benefits. You're going to give those same, through your slides, same message sets to parents and let them practice those so they become familiar and comfortable with those, and so that they might present those to their youth at home. So, and during that practice with the parents, you want to provide positive feedback, coaching, and help those parents get a little bit of practice in those messages. Step 4, you want to walk parents through the components of the goal plan. They're going to have this goal plan, and they can take it home to the parents can take this home to their youth and ask their youth complete goal setting. Step 5, have parents complete a presentation evaluation survey. There's a link there. We want to see how well your training went. We can give you that feedback as well. So we have a feedback loop from parent to us, back to you, and that keeps everybody informed as far as the quality of the training. So what you're doing as a professional, as a specialist, prevention health specialist, if you have parent programs, the advantage of PPW parent programs is they're just a single session, an hour or two. You can extend it if you want to, a half of a day if you want to, but you can keep it relatively brief to an hour or two, depending on how much of the content you present in your slides and how much time you give parents to practice. That's the beauty of it, flexible, and gets parents the materials that they need in their hand to practice these messages, goal plan, and then take that to their youth. So this is the evaluation piece, number 5. Number 6, remind parents to go to our resources page on our website, preventionplussmallest.com, for more information, free information for them. And 7 is to hand out a copy of the parent program guide. So what you're going to do is you're going to present this lesson to parents, this parent PPW workshop. And then at the end, you're going to make copies of this guide for parents, which have the materials that they practice, the messages, tips for providing messages, tips for goal setting, just, parenting tips, lots and lots and lots of good information here in this colorful guide that you make copies to and distribute to your parents so that they can take that home, continue to practice those messages, have that goal setting, and interact with their youth. Number 8, forward any unanswered questions or problems you have during your training with your parents to us, info@preventionplussmallest.com. There's our phone number again. So that's the steps, eight very simple steps for presenting any kind of a parent PPW program. Again, this is to get parents on board with presenting the same kind of positive behavior and image messages and goal setting that you'd present to them with your youth program. Does that make sense? Let me know if you have any questions. How about steps for implementing any of our new PPW media campaigns? So we've got a media campaign for sport, which addresses alcohol and drugs, marijuana media campaign, vaping PPW media campaign, which focuses on e-cigarettes, opioid PPW media campaign. So we've got these media campaigns for greater distribution of content messages, both in print format and social media. And so how do you implement those? And so we have some steps, recommended steps. Now, we don't have training for this because really we just give you these directions. There's actually directions that come with your media campaigns. Here's some of them. We don't feel that you really need to have training, but if you say, hey, listen, I need training, we'll set up a training for that. So step number 1, to implement your PPW media campaign, you have banners, you have posters, and you have a press release. And these could be used to announce and promote your campaign. It's coming next month, next week, here it is. The press release is so large and there's so much material in it, you can actually make several press releases out of it. And you could send that to the old-fashioned, I shouldn't say standard, media, print media, radio, television, but also social media, all the media sites that you're used to, that you want, and any that are used by youth and parents, because these messages are specifically made for youth and parents. So start there. That's step number 1. Use your tools. You can make banners, you can make posters, you can put these in your organizations, your schools, your work sites, buses, whatever you want. There's plenty to choose from of this content for your media campaign. That's step number 1. Step number 2, the remaining campaign materials could then be distributed throughout a targeted region. It could be a school district, it could be a whole county. for your youth, for your parents and other adults. There's content in there to host sessions. You could host a session for parents. You could host sessions for youth to distribute materials. Some of the materials also include PowerPoint slides, so you can have a lesson on, like media awareness for youth, how the media may influence them to use alcohol or marijuana, etc. So really, really good content, lots of content, lots of information. It's already made, ready for you to use the PPW media campaign. Step number 3, use the social media posts, of which there's dozens, with images, each one with an image, and mini videos, which are, I think, even more dramatic because they have actual video image of youth, healthy behaviors. You can use those and post those over weeks, maybe even months, depending on how you schedule it, because you've got lots and lots of content here. And it could be Facebook and Twitter and Instagram, etc. And so lots and lots of information. Because these PPW media campaigns are based on prevention plus wellness programs, the content will be similar if you're presenting to what you present in in your youth programs or your parent programs. So the media campaign can reinforce the youth programs, can reinforce the parent programs, and they could all make sure that these messages are heard by your school districts and your communities in your county if you use these media campaigns. And by that, I'm talking about the fact that you will have messages promoting healthy behaviors, messages identifying how alcohol, marijuana, vaping, etc., interferes with achieving those behaviors and benefits. You'll have messages in the videos and the social media posts asking you to complete a screening survey and to complete a goal plan. The goal is more than just awareness, but we want youth to take action by setting goals, multiple behavior goals. Step 4 in your PPW media implementation steps is to use the online youth pre-test and post-test surveys. Some of our media campaigns have quizzes, and then you can assess outcomes. So you can ask us, we'll send you again customized link and QR codes to the pre and post test. Now this pre and post test is actually the behavior pre and post. So before you launch your program or at the beginning, you could start collecting data from youth using the pre-test online, get it out there to youth in classrooms, in whatever settings, organizations, youth groups, etc. And then after the program, wait a month or so, and then implement the post-test. You'll have measures of 5 substance use behaviors, multiple health behaviors, and many risk and protective factors for both. So really, really good tools, a pre and post online survey to assess your media outcomes, media effects on your youth. Step 5, campaign materials are provided in digital downloads. If you order this, you just download this ton of materials to your computer, and you're ready to make unlimited copies and distribution. Number 6, all materials can be customized. You can put your logo on them, your name, your contact information, integrate local data. So you can do some tailoring if you want, integrate local data, local images, whatever you want, material's yours. You can do what you wish with it. Number 7, get youth involved. This is the last step. If you have a youth group or you want to get youth leadership experience, let them help you implement, especially, I think, the social media part. They're social media experts. Have them help you tailor, implement, evaluate your media campaign. And it's a great learning experience for them and a leadership experience. And they'll have undoubtedly great ideas in terms of scheduling and releasing of the information and tailoring, et cetera. So that's another aspect of your media campaign, is getting youth involved to actually implement it and evaluate it. All right, so those are the steps. Again, especially with the youth programs and the parent programs, we highly recommend getting training to become a certified trainer. Media campaigns, I think you'll have enough directions in your media campaign directions to implement it. But if you have any questions, if you ever need anything, if you have any problems, always feel free to reach us at info@preventionpluswellness.com. Or call us at 904-472-5022. We want to make sure you have fun and enjoy your presentations, your implementation of whatever these programs are, media campaigns, parent programs, youth programs, and that your youth are also and parents are also having and experiencing good outcomes. So if you want to learn more, there's our, to the left, that link shows our collection of our more common programs and training, and to the right, you could request a sample of any of our programs. All right, I'm going to stop at this point. Thank you so much for listening. God bless you for all you do with youth and parents in your area. We've got a few minutes now, about 9 minutes. Now's the time. If you have any comments, questions, let's see if anybody has anything to say or anything that I could say with them or with us or to us. Happy to be here again. We're happy to have you. We got people from Africa, we got people from South Korea, we got people from all over the world joining us from island states. And let's see, don't see any questions at this point. Thank you. Thank you very much. So think about it. Do you have any questions? Do you have any comments about any of the steps in implementing any of our programs, our youth programs manual, our sport video program, our new PPW goal planning tracking program, our PPW parent programs, our PPW media campaigns? Any questions about any of those? Looks like there's some more chat notes. Let's take a look at it. How much is training? Training is $249 per teacher. So again, that's the self-paced training. We also have training of trainer, which is done live online. But the idea for training of trainer, you first become a trained implementer. You implement our program once, and then you can come back and be trained as a trainer to train other providers, other coaches and teachers and professionals and youth leaders. So, but the program implementer training is $249 per person. That's a good question from Carlene, it looks like. Thank you for that. So we got some people saying, thank you. These sessions are very useful to me. Thank you very much, Esther. I appreciate that. Join late, and I'm wondering if you're going to make the slides available. Yes, Meg, you'll be receiving these slides. You'll be receiving a link to this recorded webinar and a certificate 1 hour CEU. So let me know. Don't need to email me after today. I'll be sending this out to you. If you don't receive it at the end of the day, check your spam folder, because it has these attachments and many times it'll be sent to your spam. So check for that. Meg, I'll be sending this out to everybody before the end of today. Let's see if there's any other questions. Thank you for the opportunity to be part. Let's see, apart from the PPW program, my young man ages 8 to 13 really enjoyed the program. Well, thank you so much for that, Caprice. I really appreciate that. Well, that's what we hope. We hope our youth, with the children, young adolescents, older adolescents, young adults, we've heard over the years, and it's been years now, but over, I think 12, we've been implementing this. And of course, it took us years to test and evaluate these evidence-based programs. But over the thousands and thousands of kids and families that have been provided these, very often, more often, much more often than not, kids and parents love the positive image, the positive behavior. They really enjoy these programs, and we have really found good outcomes, not just in preventing substance use, but promoting healthy behaviors like physical activity, etc. Let's see what else has been said here. Thank you for the time and dedication. It's my pleasure. Really, hey, it's a joy for us to interact with you. You did the hard work. You're the heroes. You're our prevention and health heroes. So you do the hard work, the implementation. in the field. So we're happy to support you any way we can. It's really a blessing from our perspective. I think that's it. So I'm going to say again, thanks for all you do. Stay safe, enjoy your summer, stay in touch, and we will continue to have some webinars through, I think, many of the weeks, probably something next week as well. I think we're thinking about maybe a webinar next week on taking a look at all the evidence-based registries that our programs are listed on. So that might be of interest to you. If you're not registered on our website, go to preventionpluswellness.com. Make sure your name and email is listed so you'll be notified of our upcoming free webinars. Thanks, everybody. God bless you. Have a great day. Enjoy, and hope to see you soon. Bye-bye, everyone.